Good morning. It's Monday again, so of course it's time for Question for Doc. I am Dr. Louis Singer, Singer Family Chiropractic, here in Boynton Beach, Florida, where families go to be well. And we had a really interesting question about 2 weeks ago from one of our patients, Deborah. Thank you, Deborah, for this question. And it was at the chiropractic tables, and she had heard some things about chiropractic causing strokes and sort of the what does chiropractic have to do with strokes? Well, if you've watched the news in the last, I don't know, maybe 10, 20 years, from time to time there are things about chiropractors causing strokes through the chiropractic adjustment of the neck. In fact, I don't know how long ago, but there was, maybe about 10 years ago, there was a model, a pretty famous model who she was actually doing some filming. A light fell on her head. She was having some headaches, some neck pain. She went to the chiropractor, ended up getting a stroke, and actually died. So we had discussed this, and there was a while that chiropractic was under a lot of scrutiny for causing strokes. Well, all of the research found out that chiropractors were absolutely not causing strokes. There is literally no way or very little way that a good chiropractic adjustment, adjusting the neck, can cause a stroke. What they were finding was that, we tend to think a lot of times as lay people, we tend to think of a stroke as like happening right away. Like, you get an embolism that comes up from the neck or some part of the body, goes into the brain and causes a stroke. But I will tell you this, that strokes can actually last days, hours, or even days, or sometimes even, believe it or not, a week or two. So what happens is people will be what we call mid-stroke. They will get a stroke. They'll have, of course, a lot of times headaches, or they'll have neck pain. And what do most people think about chiropractic, going to see a chiropractor? Usually three things: backaches, headaches, and neck pain. So a lot of people will go to the chiropractor because they're having a backache or a neck pain or a headache, and it's actually due to the stroke, and then the chiropractor is adjusting, but the chiropractor is actually not causing the stroke. What they're finding out is the chiropractor failed to understand that the patient was going through a stroke and was unable to get them to the proper medical personnel. So one of the things that I'm very proud of myself is I have taken many courses, some advanced courses, on looking for how to determine if a patient is mid-stroke, going through a TIA, going through a stroke. And so in our office now, not only do we ask very pertinent questions, including when was the last time you had vaccinations, but also we're doing things like what we call bilateral blood pressures, where we take blood pressure on both sides to make sure that they're even. We are doing auscultation of the neck, which means listening through a stethoscope with the arteries and the veins of the neck, making sure everything sounds clear. And then we also have some vascular tests, including one called Declanes. If you're a new patient, you've seen me do this in the office, where you're putting your head back and over to the side to see if that's causing any nystagmus, any problems with the eyes fluctuating. So I know in our office, we're very cognizant of the fact that somebody, especially with neck pain and headaches, may be going through a stroke. And I would probably say that the chiropractors of today have the training, hopefully they're using it like we are, to know if somebody is a chiropractic case at that moment or needs to be sent to the emergency room because they're mid-stroke. So anyway, hopefully that gave us some calmness and answered some questions. And thank you, Deborah, for bringing that up, because I think that is an issue that people have if they've heard of this and they're concerned about going to the chiropractor. If you have any concerns or any questions, actually give us a call here at the office at 561-739-9500, or you can reach me personally on my email at chirosong@aol.com. That's CHIROSONG, like sing a song, at AOL.com. And if you have any other questions, let us know, and hopefully we'll answer your question live here on the air. Again, my name is Dr. Louis Singer, Singer Family Chiropractic here in Boynton Beach, Florida, where families go to be well. Thank you for tuning in, and we'll see you next week, next Monday, for another Question for Doc. Have an amazing week ahead. God bless.